Do you feel 100%? If not, mineral salts could be the answer. Have you ever wondered why you're constantly tired, or why you always get muscle cramps, or why your hair is falling out, or why you can't concentrate? The answer could be simple: a deficiency in minerals. This video will introduce you to the main minerals required by the body and the signs of deficiencies of each mineral, so hopefully you can determine which mineral, if any, you may require as a supplement. Minerals are essential for life. They cannot be made in the body, they must come from our diet. Our body weight comprises 1% vitamins and 5% minerals. The benefits of minerals are as follows. They provide structural support for the skeleton, maintain elasticity of connective tissue, maintain the health of the nervous system, assist in digestion and food metabolism, are involved in neurotransmitter synthesis causing muscle fibers to contract and relax, and are essential for the proper functioning of enzymes and cofactors. Minerals have been used in complementary medicine for thousands of years. They are suitable for babies, children, and the elderly. They have no side effects and are affordable. Results can be achieved quickly and are long-lasting. Minerals may be swallowed, chewed, or crushed. They taste palatable and dissolve rapidly. Essential minerals were first identified in Germany in the 19th century by Dr. Schussler, a doctor of medicine, physics, and chemistry. Dr. Schussler studied biochemic tissue salts and found that the body needs 12 essential mineral salts, also known as tissue salts, for daily function and maintenance. These salts are essential to the structure and foundation of the organs and tissues and are vital to the correct function of human cells. Our bodies produce these salts naturally, but traces are found in fruits and vegetables. However, pollution and misuse of fertilizers and pesticides strip our natural foods of these salts, which means we do not absorb sufficient quantities. A deficiency will be carried over from mother during pregnancy to child. If the minerals are not replaced in sufficient amounts, the body draws from its own resources and becomes unable to defend itself against degenerative diseases. A lack of essential minerals will weaken the immune system, which will lead to a sluggish metabolism which, if not addressed, could result in allergies. To combat a deficiency, mineral salts may be taken in tablet form and are available in health food shops and chemists. The mineral salts required by the body include sodium phosphate, sodium sulfate, sodium chloride, calcium sulfate, calcium phosphorus, calcium phosphate, iron phosphate, potassium chloride, potassium sulfate, calcium fluoride, silica oxide, and magnesium phosphate. Sodium phosphate is known as a metabolic acid remover. It is useful for all conditions that result from an incomplete breakdown and elimination of metabolic acid waste, such as lactic acid and uric acid. It regulates the correct balance of acid in the body by splitting lactic acid into carbonic acid and water. It eliminates excess water from the body. It is used for excess acidity of cellular tissue, urinary tract conditions, gout, degenerative arthritis, kidney stones, muscular stiffness, ulceration, fibrositis, reflux and heartburn after meals as a digestive buffer, increased secretion of bile produced by the liver to help digest lipids in the small intestine, and poor tolerance of fats and cholesterol. Signs of facial deficiency include yellow mucus stuck to the eyelids on waking up in the morning, and a creamy yellow coating on the tongue and large or tight pores. Other signs of deficiency include a coppery taste in the mouth, heartburn, stiffness and rheumatic conditions around joints, burning sensation on the skin, constipation, and a craving for sweets and starches. Sodium sulfate is known as a problem fluid remover. It is important for cellular integrity and plays an important role in detoxification of the liver. It is used for edema, especially when associated with lymphatic stress. poor detoxification, especially where liver function is sluggish, and inadequate bile flow. It is good for intolerance of alcohol and fats, jaundice, pregnancy, edema, swelling, and weepy eczema. Sodium sulfate stimulates kidney function and helps with fetal hormonal secretion. Signs of facial deficiency include greenish-yellow colour on the face, bluish-reddish nose, strong vertical lines between the eyes above the nose, a furry tongue, and yellow whites of the eyes. Other signs of deficiency include hay fever, liver problems, sick headaches with giddiness, sensitive scalp which is painful for combing hair, and nausea. Calcium phosphate is a major constituent of bone and teeth, and it is a vital component of muscular contraction. When teeth crumble, it is due to a deficiency in this mineral. Calcium phosphate stimulates secretion of neurotransmitters, hormones, and enzymes, and acts as a stabilizer for nerve cell membranes. It promotes growth in young children because of its importance to the soft-growing tissue. It is good for mental retardation and stunted growth, all bones and teeth disorders, rickets, osteoporosis, and osteomalacia, which is softening of bones, most often caused by severe vitamin D deficiency. Calcium phosphate aids as a fast recovery to people who are convalescing. It is good for young girls with heavy menstruation as it combats anemia. Women tend to suffer with calcium phosphate deficiency more than men. One of the reasons is that during pregnancy, her need for calcium phosphate is great for the developing embryo. If the need is not met in the diet, then the body will draw the baby's needs from the mother's own resources, which could leave the mother suffering from teeth problems. Calcium phosphate is also indicated for disorders of glandular secretion, poor digestion and assimilation of food and malnutrition, nervous irritability and insomnia, personality changes, hyperactivity and numbness. A crawling sensation in the extremities, cramps, twitches, convulsions are also signs of deficiencies. Also tetany or cramps due to low blood calcium, cardiac arrhythmia, preeclampsia, epilepsy, respiratory distress, dyspnea or difficulty breathing, frequent colds, and low resistance to infection. Facial signs of deficiency includes a pale, waxy complexion, soft teeth, and a gaunt face. Other signs include childhood introversion, numbness, palpitations, melancholy, tearfulness, slow bone healing or osteoporosis, and a tickly cough with no mucus. Iron phosphate is essential for life and is used in the transport of oxygen in hemoglobin and is a prime source of cellular energy. It is found in blood and hair. The body only absorbs iron when it is required. It is known as an inflammation remover, as it is used for acute localized inflammation and infection resulting in heat and pain, and is used for the first stage of fevers. It is also used for anemia associated with listlessness, nutritional iron deficiency, paleness, tiredness, weakness, hemorrhage, nosebleeds, bloody discharges, and respiratory infections. It is good for children, growth and pregnancy, and breathlessness, and it is essential for heavy menstruation, palpitation on exertion, low resistance to infection, acute and chronic inflammation with fever. Along with potassium phosphate, iron phosphate improves the immune system and should be used for colds, flus, and bacterial infections. It is an ideal supplement for children who don't like green vegetables. Facial signs of deficiency include a red, flushed complexion, dark shadows under the eyes, and flushed red ears. Further signs include low immunity, frequent colds and flus, bacterial infections, tiredness, shortness of breath, bleeding, vascular pain, headaches behind the ears, constipation with burning sensation in the rectum due to dry feces, which may cause hemorrhoids or piles, and a prolapsed rectum. Potassium chloride is known as a congestion remover and is used for low gastric acid production. It is a blood conditioner and detoxifier and is found in the muscles, nerves and brain cells. No new brain cell formation can occur without potassium chloride. It is required for blood clotting and is the main remedy for spasmodic croup. It should be taken to treat all skin diseases that manifest in blisters such as chickenpox, herpes and shingles. It should be taken in alternation with iron phosphate for mucus conditions. It is very good for catarrh in the eustachian tubes, which are the tubes leading from middle ear to the throat, which, when blocked, cause temporary hearing loss. Potassium chloride is needed for a sluggish liver which does not produce enough bile, resulting in pale-coloured stools. It is good for poor synthesis of collagen, swollen congested glands, fibroma, hepatic ulcers, burns, poor digestion, low potassium levels, abuse of antacids, and metabolic alkalosis and oedema or swelling. It helps regulate blood pressure and hypertension associated with high sodium chloride intake. It is also good for diabetes and diuretic therapy where renal potassium losses may be high. Facial signs of deficiency include a whitish blue shade around the eyes, usually on the upper or lower eyelids, glandular swellings, a sticky mucus exuding from the eyes, swollen and painful cheeks, and a grey coating on the tongue. Further signs of deficiency include warts, nausea, especially morning sickness during pregnancy, a thick white discharge exuding from anywhere on the body, and allergies. Potassium sulfate carries oxygen and is used for all symptoms that demonstrate abnormal cellular respiration and is associated with the structural integrity of the cell and is involved in production and repair of cell coats. It is indicated for dermatitis, eczema, psoriasis, scaling of the scalp, nettle rash, acne, excess mucus, especially from respiratory and gastrointestinal mucosa, hearing loss due to catarrh, low energy levels, and a desire for fresh air. It is useful for the kidneys, especially during pregnancy, as the kidneys are overworked, filtering out extra fluids. Therefore, more women are deficient in potassium sulfate than men. Signs of facial deficiency include oily, greasy skin with yellowish eruptions, brownish-yellowish face colour, dry scalp with yellow scales, dandruff, and a slimy yellow-coated tongue. Other signs of deficiency include discoloration of skin, especially a bronze appearance, and a strong desire for fresh air due to lack of oxygen, inflammatory pain, and age spots on the hands and face. Silica is referred to as a calcium reorganizer. It is an essential trace mineral and a rich constituent of most kinds of dietary fibre. Silica is found in all human tissues. It is indicated for poor wound healing, weak finger and toenails which split easily, disturbed tooth development and poor bone mineralization, increased sweating, atherosclerosis, poor joint formation, a decrease in the amount and density of articular cartilage, gout, osteoporosis, osteomalacia or softening of bones, and ankylosing spondylitis, an inflammatory disease that over time can cause fusion of some of the small bones in the spine. It is also good for oversensitivity to noise and light. Facial signs of deficiency include a shiny bald head, glossy tip of nose, brownish tongue, polished shiny forehead, dull fluffy head, hard lumps beneath the skin. Other signs of deficiency include aggressiveness, irritation, and lack of concentration in children, sensitivity to light and noise, and falling hair. Calcium fluoride activates enzymes, normalizes the bones, teeth and connective tissue, improves tissue strength and reduces tissue strength where there is an abnormal buildup. It is indicated for lack of elasticity of connective tissue, vascular wall, muscular wall, mesentery and suspensory ligaments, joint articulations and epithelial tissue or tissue which forms a covering of body surfaces, line body cavities and hollow organs. Without the correct amount of calcium fluoride, the skin will become flabby and loose and stretch marks will appear. It is also useful for osteoarthritis, rheumatoid arthritis and polyarthritis, glandular disorders, including exudations from the capsule, breast lumps and chronic mumps, which is a contagious disease causing fever and swelling of the face. Calcium fluoride is also needed for good bowel movements. Calcium fluoride is normally found in water, however, in many countries, the amounts necessary are scarce. In this case, supplementation of calcium fluoride is necessary, otherwise the body uses it from areas such as the skin, leaving it dry and cracked, or the tooth coating, leaving the teeth stained brown. Signs of deficiency include cracked heels, dry elbows, constipation, hard calluses under the feet, flabby stomach, and stretch marks. Facial signs of deficiency include brownish red markings around the eyes, especially in the corners above and below the lids, and dry flaky skin. Calcium sulfate helps with wound healing and is used for ulceration, abscesses, boils with pus, a bloody discharge, catarrhal exudations, skin scaling, acne, dermatitis, eczema, and psoriasis with discharge. Calcium sulfate has a good relationship with silica because both are excellent for purifying the blood. Calcium sulfate removes waste from the blood and cleanses and purifies the entire system. Facial signs of a deficiency include severe adult acne, pustules with a thick creamy mucus. Other signs of deficiency include excess mucus and catarrh in the lungs and bronchioles. A deficiency delays the removal of decaying matter, resulting in boils, carbuncles, and abscesses. Magnesium phosphate is an important mineral in energy production. It is an antispasmodic painkiller, important in enzyme activation, and is necessary for the proper utilization of phosphate in the storage and release of energy. It is essential with phosphate for the activation of most vitamins. An imbalance causes muscles to contract, causing muscular cramping, bone pain and paralysis, low energy states, loss of nervous regulation, premenstrual tension, cardiovascular abnormalities such as pain, arrhythmia, alcoholism, drug abuse and withdrawal, impaired renal function, and Raynaud's syndrome, which is a medical condition where spasm of the arteries causes reduced blood flow. Typically, the fingers, and less commonly the toes, are involved. Rarely, the nose, ears, or lips are affected. An imbalance also causes migraines and interrupted vision due to the spasmodic condition of blood vessels that feed the retina. Facial signs of deficiency include redness around the nose and a flushed face. Other signs of deficiency include a lean, thin body, a nervous disposition, muscle cramps, bloating, migraines, hot flushes, sharp neuralgic pains, and teething pains in babies. Potassium phosphate is a nerve nutrient found in all cells and is particularly necessary for nerve and muscle function. It is excellent for students who are having trouble concentrating. It is used for nervous exhaustion such as extreme tiredness and weakness, despondency, depression and lethargy, anxiety, poor memory, nightmares, dry mouth, skin and tongue, and offensive breath. Facial signs of deficiency include brownish coating to the tongue and a tendency for the tongue to stick to the roof of the mouth. Other signs of deficiency include mental anxiety, pessimism, slowness of brain, poor memory, mental and physical exhaustion, and procrastination. Thank you for watching this video. If you enjoy this content, please hit the like button and subscribe to the channel for more informative videos on health conditions and their treatments, natural remedies, and nutrition.